This is definitely a sleep-deprived conversation we're having right now. And I thought the caffeine would help, and it's not.
It's not kicking in.
It's not doing its job. I'm Brian Petteway. I'm associate professor in the School of Public Health, and I'm the winner of Researcher of the Year for the School of Public Health. Epidemiology, the study of the causes and distribution of diseases. As a social epidemiologist, I focus on the causes of the causes, as I say. What I care about are the structural, cultural, and political economic factors behind the causes of differences in population health outcomes. Thinking about who's most likely to be exposed to hazardous air quality, who's most likely to live in lower quality housing. So I start thinking about things like structural racism, poverty, classism, things of that nature. My area is what's called place health research. And so in this area, what I focus on is how things like neighborhood conditions within people's daily spaces, right? For me, I think about place beyond just a residential neighborhood, but also where people, like the phrases like live, learn, work, and play. I use CVPR and YPAR and participatory methods to help residents themselves do their own research to research their own daily place health experiences. So one of the current projects I'm working on right now is called the YHEART PDX project, which stands for Youth Health Equity and Action Research Training. What this work involves is training youth to do research in their own daily place health experiences using exclusively participatory methods. So things like photo voice, which involves photography, participatory GIS, which involves community mapping, and then also I engage creative arts like poetry. And the idea is that creating an opportunity for those who are experiencing historic and present forms of social inequality that produce health inequities to be their own storyteller, to create their own narratives about health in their communities. Right now, nationally, less than 6% of tenure-track faculty are African American or Black, less than 6% are Latinx, and 0.3% are Indigenous. And yet there's a multi-billion-dollar industry to do research on health inequalities, oftentimes on racial health inequalities. And so what my work tries to do is train youth to potentially become future researchers by researching their own lives and telling their own stories, and not necessarily having someone else come and tell them their stories and tell stories about them. My inspiration really comes from my own lived experience. There's a lot of research, billions of dollars, on population health inequalities, especially on things like poverty and racism, but a lot of that research is not done by folks who have experienced the health outcomes or the social inequality that they're studying. And so for me, as somebody who did experience those things personally growing up, I think it's important that I do what I can do with the privilege that I have now to actually open up those doors and try to figure out if we can get more folks to be able to tell their own stories, to do their own research, to narrate their own perspectives about what's going on in their communities. I'm Brian Petteway. I'm a social epidemiologist. The primary goal of my work is to really change the narrative and to reimagine how we do public health research, to center the voices of those who are experiencing the largest health burdens so they can tell their own stories, to kind of remix and reimagine what that conversation can look like using creative methods and participatory methods that center community voice.